Hi guys, Reba here at Oregon Health and Science University, working with Foundations of Emergency Medicine and Kristen Graybo-Moore out of Emory University and Dr. Andrew Perot out of University of Kansas. And today we're going to be talking about our old friend, the bag valve mask. I'm going to give you a few tips and tricks that you may not know about this guy. So everybody knows that we squeeze this over the patient's face to oxygenate them when they're not breathing on their own, or maybe when they're apneic. But we'll go over how to set it up appropriately and a few other ways you can use it. First of all, if your bag comes scrunched up like this in the bag, you want to pop it all out, pull out this reservoir, make sure it's plugged into the wall. I've got my oxygen cranked all the way up, as high as it'll go. That's what we call a flush rate. And so that rate, we want to flush the bag with 100% FiO2. So you're going to crank the wall as high as it'll let you go, and you should hear it screaming behind you. In order to get 100% FiO2 into the bag, there are valves on either end of this bag. So you're going to have to give the bag a few squeezes to truly fill it up with oxygen. The next thing you're going to do is get your mask, get it secured on there. If you want to pre-oxygenate your patient with this while they're still breathing, you can hold it over their face, but you have to squeeze the bag to release this valve and let the oxygen out. You can't just hold it here. No oxygen is flowing like this. One of the other tricks with this guy is called the PEEP valve. I don't know how many of you guys are familiar with this, but it's a little spring-loaded valve that you can dial up and down. So it usually comes dialed up at 5, so a PEEP of 5. If I want more positive pressure immediately post-intubation because I think they've had some atelectasis or aspiration and I've got to get those airways open, you're going to twist it down to maybe 15 of PEEP on that valve. It pops onto the end of the bag here, so that when you're holding it like this, it's off to the side. Next thing you want, depending on how many operators you have, you could do a nice two-handed technique, and you're going to lift up. You want to lift their jaw up into the bag. Never smash down onto their face. If you press down, that might feel like you're getting a good seal, but all you're doing is collapsing their airway as you press their chin into their neck. So a big lift behind the mandible, it should be a really tough hand and forearm workout to lift that mandible into the bag. If you're by yourself, CE technique, make a C around the mask. You're going to have to lift that jaw with one hand and really press the mask down with the other. Start bagging with your other hand. A little trick that a lot of people don't know about the bag valve mask is that there's actually a side port for oxygen here. So if I open this up and attach oxygen from maybe a second wall unit, this is going to bypass both of those valves around this bag reservoir. And so by putting oxygen in here, maybe turning this PEEP dial to 10 and placing it on the patient with a good seal, I'm effectively delivering 10 of CPAP right now. All right, guys, happy pre-oxygenating. Go out there and get some good airways.